bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, and the McMaster Children's Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities: Hello and welcome to today's episode of CAFC Presents. My name is Doug Maynard and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And it's my pleasure to welcome everyone back after what's been a fairly slow summer from the webinar perspective. This is the first one, I think, in a couple of weeks at least that we've had. So it's nice to see we've got quite a large audience interested in today's topic. And I'm sure it's more because of the topic that is of interest and the fact that no one else has anything else to do in the summer. Today's webinar is titled Youth Mental Health in Canada, Supportive Resources Upstream of the Emergency Room. And before we get to the presentation, I've got a couple of announcements and also to make sure everyone's familiar with our webinar process. First, I just want to make sure everyone is aware of the upcoming CAFC annual conference, this year being held in Calgary, Alberta. Our theme is Climbing Mountains, Leadership and Resilience in Pediatric Healthcare. So we've got a lot of great speakers on leadership and resilience and all sorts of other great topics. But we're also very pleased to announce a couple of celebrities that'll be joining us. First, we'll be having our good friend and supporter, Alex Bilodeau, our Olympic gold medalist skier from Vancouver and from the Sochi Olympics. He'll be joining us for the first time. His family's been there a number of times, but Alex has always been skiing and practicing in October, which is when our conference is before the Olympics. So he's never been able to join us, but this year will be his first appearance at our conference. So we're very excited to welcome Alex there for the first day of the conference. And we also have Paul Brandt, being a local hometown hero in Alberta. Paul Brandt, award-winning country music singer, will be joining us as well. So it'll be a great conference, and we hope you join us there. And if you just go to our website at cafc.org or our conference site, conference.cafc.org, you can certainly find more information as well as the link to register and all the other information that you need. Second announcement is we are doing a survey to help us improve our webinars, the CAFC Presents webinar series. The survey will be open for another week, and Samantha is going to put a link in the chat box that can take you to that survey, and that'll give you a chance to give us some feedback on what you think of our webinars, as well as how we might be able to improve our webinars going forward. So on to the webinar. As always, we do take your questions at various times throughout the webinar. So I encourage you to type your questions into the question box as you think of them. And that question box is in the control panel that usually appears on the right-hand side of your screen. And again, just type them in as you think of them. Don't feel you need to wait until we call for questions before you start typing them in. You are free to come and go from the session. It doesn't interrupt the session, and we do record the entire webinar in case you do miss something, so you can always go back to the recording and catch up or share that recording with anyone else that you'd like to share it with. We do post them publicly on the CAFC Knowledge Exchange Network, along with any other resources such as PowerPoint presentations or anything else that you might be interested in that our presenters might be able to share with us. Usually takes a couple of days to get that information up. But you will receive an automated email message from the system with a link when that becomes available. So now let's get on to the presentation. You may recall from a few months ago, we had a presentation about engaging youth through technology, where we brought our colleagues from the Children and Youth in Challenging Contexts Network, the CYCC network. That was Michael Unger and Lisa Lachance. And in that presentation, one of the CYCC members, the folks from Mind Your Mind, were part of that presentation. And that was Maria Luisa Contursi and Taylor Holden presented. And they introduced us to a couple of tools that Mind Your Mind had created. And we had so much interest about those specific tools. That's what everybody always wants, is those real practical, useful tools that they can take back to and integrate into their practice. People were so interested that we invited Mind Your Mind back to tell us a bit more and give us a bit more detail on some of the tools and resources that they have created. And what's even better is we're bringing this in the context of a issue that is so relevant to our community, and that is children with mental illness and mental health issues presenting in the hospital emergency rooms in a way that really in places where they're not the best places for children with mental illness to be treated. So this is about trying to address upstream from that and get practitioners, families, children, resources that might help them upstream from the ER. So it's my pleasure to introduce two colleagues from Mind Your Mind. First, we have Eugenia Canas, who is the coordinator of Mind Your Mind's Community of Practice, which is a growing multidisciplinary group of professionals dedicated to youth mental health. She's worked in communications and engagement for over a decade and is an art therapist in the areas of child and adolescent oncology and mental health. And she's a PhD student in health and information science at the university at Western University. And we also have Andrea Kirkham. Andrea has been an educator since 2002, working with youth in both the public and private sector. And she has been the curriculum writer at Mind Your Mind since 2010. And she loves the process of working with young adults and the rest of her team to develop resources that will hopefully expand people's knowledge and understanding of mental health. So it's my pleasure to hand the virtual podium over to Eugenia and Andrea. Over to you.
Hello there. We're going to talk briefly about Mind Your Mind. Mind Your Mind is an engagement program that partners youth and the professionals who serve them to create resources and information that fight the stigma of mental health. I want to clarify, we do not offer clinical services. Instead, we foster conversations. We work alongside youth to empower them with accurate information so that they can talk about mental health with one another and the people who support them, and reach out for help when needed. So that's about our program. We'll get you used to our voices. This is Andrea.
Hi, everyone. I'm Andrea Kirkham. I am the curriculum writer at Mind Your Mind. I'm a certified teacher, and my role at Mind Your Mind is basically to co-create resources with my team and with young adults around the topic of stress teaching, disciplinary perspective, and how it applies to anti-stigma, psychoeducation, and building language capacity for youth to talk about health and wellness.
And this voice is Eugenia, and as Doug mentioned, I am my role is community of practice coordination, and that means that I'm a clinician working with a community of youth-serving clinicians throughout Canada. This community is fairly diverse, as I know that our audience is today. And so we recognize the range of needs that can emerge and that the kinds of perspectives that you might bring to this conversation. And also, as Doug said, we invite you to share your perspective through the media available in this webinar. I want to talk a little bit about the Mind Your Mind team because it's also very multidisciplinary. Mind Your Mind is made up of healthcare professionals and professional creatives. And right now we are 14 of us. We have creative staff such as graphic, web designers, and programmers. Andrea is a teacher, as mentioned. We have 2 therapists on staff, 1 youth crisis worker, 1 psychiatric nurse, and 1 information scientist. Additionally, we are a program of Family Service Thames Valley, which is a long-standing community agency. And FSTV offers individual and group counseling, crisis services, EAP, community integration, and clinical internship programs. They've been around since 1939. And at Mind Your Mind, we consider it a great privilege that we have access to the support and expertise of all these clinicians at FSTV. I think what unites us all, what gets us out of bed in the morning and happy to work, is our commitment to youth. And I also have a sense that if you're here at this seminar, at this webinar, then that's also something that drives you. So at Mind Your Mind specifically, we believe and we see repeatedly the innate strength and resilience, the creativity that youth invest into that decision of helping themselves and their peers. And we really, really invested in doing this early on, well in advance of a crisis. Because we also see youth as a time of great vulnerability and potential. Excuse me. So research tells us that approximately 30% of conditions that cause adult death are actually caused by behaviors that begin in adolescence. And so that's the potential and the vulnerability of youth. Let me tell you a little bit about the Canadian landscape for mental health. 70% of mental health problems have their onset in adolescence. And we know that about 1 in 5 young people who need mental health services currently receive them. Survey results by Statistics Canada show us that of all youth who have a self-identified mental health concern, only 1 in 4, 25%, will reach out for help. So we want to know, and we want you to reflect and, if possible, to share with us, in your experience, what is preventing young people from reaching out early? That has been a question that concerned Mind Your Mind from the beginning, and is a key component of its origin story. About 12 years ago, the founders of Mind Your Mind started seeing a lot of young people show up at the emergency room with a mental health concern. They were showing up without any knowledge or experience of the resources available to them, and the feeling was that crisis after crisis could have been prevented with early help seeking. But youth were not reaching out. When consulted, when really asked, they shared that what was holding them back was really a combination of 3 things. It was stigma, or the fear of opening up something that they didn't know what to do about, that mental health diagnosis. It was a complete lack of the language necessary to talk about mental health. And thirdly, it was just not knowing how to navigate the system. So these things were holding them back, and Mind Your Mind set out to support youth in these particular areas well in advance of the emergency room so that they could reach out, get help, and also give help to their peers. And that has been the focus for the last decade. That has been the focus of our co-creative projects with young people. We create information that fights stigma, addresses the lack of information out there for youth, and equips them with the language and skills that will help them navigate the health system. So I want to bring to mind that 1 in 4, that 25% of youth who reach out, and share with you that through our evaluation of our program, we have reached out, or we have identified that 63% of youth access support after spending time on Mind Your Mind's online spaces. The kinds of supports that they access may be formal or informal. That may include reaching out to a sports coach or a school counselor or a family doctor and saying things are not feeling so great lately. But that early step is key in preventing a crisis later on. So that evaluation, that 63% that we're showing, is actually 158% of the national average. And that is only possible with the collaborations that we have with young people and with professionals who serve them. One of the key collaborations for us, especially in the last 3 years, has been with the Young Health Program. The Young Health Program is AstraZeneca's global community investment initiative. It was created to help young people in need around the world to deal with the health problems that they face and to improve their chances for a better life in the future. The program is a partnership of AstraZeneca, that would be globally and also in Canada, Johns Hopkins Bloomberg School of Public Health, and they are set in Baltimore, and Plan International, the leading global children's charity. This partnership in particular has supported Mind Your Mind in allowing us access to evidence and to key research team relationships. And one global outcome of the Young Health Program has been a special issue of the Journal of Adolescent Health. Some of the evidence that came out of that journal, out of a very diverse team of researchers, include findings on the crucial impact of environment above genetics. And my favorite finding is evidence to the fact that adolescents are more sensitive to positive reinforcement and less sensitive to punishment than either children or grown adults. Now, any of you in the audience who may have also the role of parents, you may find that this plays out with your teenage children, and I'd be curious to know about that. But this is all to say that the global partners have provided research and networks, while the local partners provide the contextual relevancy of what's really mattering in each country. The Global Health Program has been seeking to address or to support 25 countries by next year. I think that they are at 18 right now, and the focus has been different in every country. Just to give you an example, in Korea, the focus has been on suicide prevention, and in Portugal, the focus has been on the mental health of preteens, so children 10 to 12 with behavioral problems. In Canada, the Young Health Program aims to foster the emotional and mental health of adolescents ages 10 to 19. And the work here has been a combination of on the ground, online, and through networks. So we've been working with Physical Health Education Canada through the Education Network, with the Boys and Girls Club as an on-the-ground interface with young people. And Mind Your Mind has been developing the online components through resources and education that are web-based. Overall, we're working to create a culture where mental health is discussed as freely as physical health, here's the hope, and just as preemptively. And so I also wanted to share with you very briefly some of the other key partnerships that guide our work and just give you a more holistic sense of who we are working with as a way of inviting you to collaborate with us. We will be asking you questions through this webinar, but overall, I wanted to note that we are an agency of record for the Ministry of Health and Long-Term Care, and we receive about a third of our annualized funding through them.
So this is Andrea talking, and the teacher in me wants to also express that we've got a really great close working relationship with with the Ministry of Education and our local school board. We've got a beautiful partnership with them. And later on, I'm going to be talking about some of the tools that we've developed based on Mobilizing Minds results. You'll see the Mobilizing Minds there on your screen as one of our key partners, and I'll be talking a little bit about the connection.
So overall today, as we begin to share a host of resources, we want to ask your collaboration and wonder whether we can collaborate with you by getting your thoughts on how implementable, how useful these kinds of resources would be for you. And as we go through, we also invite you to think about how you might weave these resources into the work that you're doing. Keeping in mind that these resources were co-created with youth, and for that reason are very resonant with them. They mean something, they echo their perspectives, and other youth really pick them up and champion them fairly easily. A question before we begin is to reflect, therefore, on your own practice and tell us a little bit of how often do you use online tools when working with young people. We know that online is a place where youth are. It's part of their habitat, as it were. So we'd love to know from you just how useful online tools can be in your practice right now. And beyond this question, I'll hand it over to Andrea to walk you through the resources.
And so the results are 61% sometimes use the online tools, 20% often use them, and about 20% say they never use online tools.
That's interesting. Thanks for sharing that with us. So just keep that in mind, your answer in mind as we move forward. It's Andrea speaking now, and I'm going to be spending the next few minutes actually looking at a resource. I'm going to be hopping back and forth between our PowerPoint and actually showing you live on screen our tool, which is mytoolkit.ca. So let me just actually go back. So here we are. We're looking at mytoolkit.ca. And this is sort of when you arrive at this landing page, you'll see this is basically a menu of resources here that can be used with a variety of different people at different stages in their journey, their health journey, whether they're in treatment or maybe they just need some information. So there's lots of tools here that could be applicable to different scenarios in healthcare. And I'm really going to be focusing on these modules. There's two modules here. They're called the A to Z modules. One, I'll tell you how these were sort of developed. These were created on the heels of the positive evaluation results that Mind Your Mind received from the Canadian Mental Health Commission's Opening Mind study, which evaluated an online learning module that we had created a few years ago for our local school board in 2009. So after this tool that we created was evaluated with a curriculum resource for teachers, the results were lovely. They were very encouraging, and they suggested that the students who used these online lessons not only had changed attitudes towards those with a mental illness, but also they indicated to us in their comments and in the findings that the method of delivery, i.e., online interactive learning modules, they really liked them. They thought that was an effective way to sort of have the information delivered to them. So when we were creating these modules that we're going to take a look at in the next few minutes, we really used and wanted to build on what was working according to that study. So first we focused on creating a wellness module, and then we moved on to create a stress module. So we're going to look at the mental health A to Z wellness module first. This is kind of designed to be a tool for clients who might just need some good information about basic health and well-being. It includes graphics and videos and interactive tools, plain language content that's really readable and digestible about general mental health and wellness. I'm going to pause again. We have a quick question for you before we sort of hop in here, and I'm just going to open up this poll here. So far, you haven't seen them yet, but so we know that they're online learning modules. Anyone can access them with internet. And I guess my question to you would be, what would help you in using online modules like A to Z in your practice?
The majority are saying stories from clinicians and families who use it, followed by more evidence on the effectiveness of the tools would help. Then we have more updates and tips, followed by more training, and then better technology at hand is at 37%.
That's great. Thank you so much for sharing that. This is really, really interesting as we move forward. I'm just going to hop back to the modules here. So first I'm going to show you that when you click on the modules, we're going to look at wellness first. You click on here, so here's the first page for the wellness module, and you're going to see that there's a little introductory video, and then there's some different topics all about wellness. But the top one here, I just want to quickly show you, this is a facilitator guide. Both the modules have a facilitator guide attached to them. It's a downloadable PDF. That you can print off or just refer to. So these were designed to develop to support any youth-seeking or youth-serving, professionals who want to use the modules by just providing a really good outline and different options for how you might deliver the content, ideas for discussion questions, and extension activities. So you can see here as I'm scrolling through, when you're sort of thinking about how you might use something, we've sort of done some of that work for you. We've sort of wanted to make this really usable for youth-serving professionals, so we decided to create this facilitator guide to help people out. I want to say too that there's no rules for how you use these modules. They're designed to be user-friendly, versatile for both youth and the professionals that serve youth. So some professionals might choose to just pass this link on to young people, like say, hey, check out mytoolkit.ca. Some might ask youth that they work with to go through and check it out on their own. Some might actually sit down with a client, and we know at Mind Your Mind that some professionals do sit down with their clients and use our tools sort of in a one-on-one situation. And others who work with groups to maybe deliver content to groups of youth might decide to project this on a screen, all or just, or some of the resources in the modules as a sort of a group teaching tool or just a way to start conversations. you'll notice on the home page for the module that there are different menu options. So there's different topics here. Again, you can decide that you're going to start from the beginning when you know what is emotional wellness here and just sort of click through in a linear fashion, or you can just jump to whatever you want to get to in that moment. So I'm going to click on what gets in the way here, and I'll just show you how it's set up. You'll see there's a back, home, next. I'm just going to click through, and you can see that we'll be showing you a few of these tools on here, because you can just jump to whatever resources. As you get to know the modules, you might know that you want to use a certain video or a certain tool, and then you can just jump right to that, or if you want to go through it, page by page, that's an option as well. I'm going to start by showing you this video that appears on this page of the module. This is a video that was created specifically for this module. I'm just going to...
A mental illness is not a character flaw.
It has nothing to do with being weak or lacking willpower.
People dealing with a mental illness did not ask for it or choose it.
People dealing with a mental health issue can't just snap out of it.
Having a mental health issue is not about being unintelligent.
Mental illnesses are not the same as developmental disabilities, intellectual disabilities, or brain injuries.
Having a mental health issue does not mean that you are weak.
People can experience mental health issues no matter what their age or background is.
It doesn't matter how much money you make,
What the color of your skin is,
Who your friends or family are.
What school you go to.
or what neighborhood you live in.
anyone can develop a mental health disorder.
What can cause or trigger a mental health issue?
Psychological factors like low self-esteem,
Or the inability to deal with anger or stress.
Personal issues like the breakdown of a family,
Or an abusive relationship.
distressing life events,
Like a death of a loved one.
extreme stress or trauma,
Like experiencing a rape, ongoing abuse, or a violent event.
biological factors like hormones and the chemical balance in the brain,
Genetics. Like if someone in your family has experienced a mental health issue.
Drug abuse can trigger mental health disorders.
Or cause already existing issues to be worse.
any of these factors alone or in combination can cause or trigger a mental health disorder.
The good news is that mental health is like physical health.
You can find treatment and you can do things to keep yourself well.
There are steps that people can take to keep themselves mentally well.
Like learning how to deal with stress
Recognizing the signs of mental health issues.
and finding out where to go when help is needed.
Basically what that video is, we worked with you to create the content for that video, and I want to point out that that video in particular is about what can get in the way, get in the way of emotional or mental wellness. And while mental illnesses are discussed, in some of the content of this module, the focus here is really on looking at what young people might think about mental health and framing mental health as a universal issue and focusing really on what makes a person well. So I'm going to sort of just be jumping through here. Just going to page 3 here.
Andrea, we just need you to show your screen again. I think it.
I'm so sorry.
Yeah, that's all right.
I'm sorry. I didn't realize. So here we are on this page. It's okay. You didn't miss anything. Don't worry. On this screen, I just want to pause here for a minute and sort of reflect on the idea of relationships, because when you're working with young people, as many of you probably know, relationships are really key. And there's many opportunities built into these modules that exist simply to start good conversations. Throughout the resources, you'll know these green connect the dots icons. These appear on almost every page. And when you hover over them, you're going to be either shown some more in-depth information about whatever's being discussed at this part of the module, or it's going to be something to prompt reflective thinking or conversations by asking questions. So on this page, we're seeing that when you hover over the dots, it's describing more in-depth the contributing factors of resiliency, which is what's outlined on this page. We click next. Let's take a look at what's here. So here's an interesting page that I love. It talks about how other young people have defined wellness through artwork. So it's asking users to reflect. You have her over here. When we have her over here, this page is showing examples of what young people have created visually to sort of express what their idea of wellness is. And then the connect the dots icon is something that you could use to turn to your clients and say, well, how would you paint the idea of wellness? The benefit to you as a service provider would be that the tool acts as like an equalizer in the learning process. It's not you, the facilitator or the expert or the nurse or the doctor, questioning the young person. It's the tool asking the questions. You become the partner that's journeying through the resource alongside the client as an equal. And so hopefully through this dialogue, you're sort of gaining the opportunity to strengthen the relationships that you have with the youth that you serve.
This is Eugenia jumping in for a second, because Andrea, you're making me think about something very important with youth clients, and it's just how self-motivation and motivation in general is so key in how they go about acquiring information, right? So an interesting stat for us is that our online games have a 35% completion rate when youth are entirely self-motivated. No one's told them to go play that particular game or resource, so they just happen to know about Mind Your Mind, and somebody opened the door a little bit in a conversation. They go and they play for about 5 minutes of completely self-initiated psychoeducation. And an overall game, an entire game, may be 20 minutes of psychoeducation, which is, again, increasing that language capacity to have those conversations early on.
Yeah, and that's a great segue, actually, because this is what I wanted to show you next. You should be seeing here, this is one of many interactive elements in this resource. It's a little quiz. It's funny when we talk about when we've made other resources for youth, they've indicated as they've in the co-creation process and after just getting feedback, they love quizzes for some reason. And so here we are with a little a quiz. The user takes the quiz. And this is just sort of taking through to assess what they know and what they don't know about stress and stress management. And then, and then after they answer the question, this little pop-up comes up to sort of follow up, or give them some food for thought. So this is a great example of an element that you could just pull out of here. Like maybe you're not going to use this whole resource, you just know that this quiz would be helpful in whatever it is that you're doing with your clients. And this could be just a standalone resource. I'm going to take a minute here. I'm going to put you guys on the spot yet again. Is this a poll question? Yeah, perfect. So I'll jump to the next poll question here. And sort of just show you full screen here. So I'm just wondering, so we just showed you there's this little quiz, 10 questions, a little multiple choice thing that a client could do themselves or on their own. And I'm wondering, would quizzes or are quizzes useful? Would that be useful to assisting you in delivering stress management information to youth?
And I guess we can close that off and flip that around. And it looks like 66% say yes, it would be helpful. Only 2% have said no, but 32% have said they've never tried. So.
I'm going to move back a few pages here, and I'm going to play another video for you guys. So one of the things that Mind Your Mind has learned over the years is that, when we build, we're often building in the way that we deliver information. We try to build in the pillars of youth culture. So thinking about things like art and fashion and music and sports and entertainment media. And we sort of embed this sometimes in the delivery of our content. I'm going to show you another quick video here. Hang on a second. Through the video player here, where we're going to see the singer Light. Hopefully some of you know who she is. All young people seem to know who she is, talking about her experiences.
In your song White of your first EP, the chorus is "Turn your shadows white." To me, the message is clear: transform the negative in life into the positive. Is this a reflection of how you deal with negative aspects of your life?
Sort of. I mean, that the idea was that when I wrote White, I had this idea in my mind, this sort of concept that when you're working through whatever you're working through, there's like a little man walking around in your body with a flashlight.
Yeah.
And he walks into into the ends of your fingers and the inside of you, like hollow, right? And looks in all the nooks and crannies for any darkness and then shines a light on it, right? That was the visual I was working with for that song, and that's what that was kind of about. Where it's like you can't deal with all your problems at once, but little by little you go in and you find every little thing as you go, and that was the cathartic process of songwriting for me. And that's kind of what I do. You can't tackle everything at once, but little by little you can find everything slowly and surely. That's so cool.
You know, as service providers, I know as a teacher, like I'm always trying to get information across about a variety of topics. So, you know, if we're talking about stress management, we want to tell young people about stress management and why it's important. And then here we have Light, this young, popular, really cute, adorable, you know, popular singer, and she's talking about this very topic in a really straightforward way. And I think it's really powerful to hear someone that you admire talking about mental health so matter-of-factly. Young people pay attention, we know this, when we meet them where they are and incorporate the things that are important to them in the conversation. And so I think this video is a beautiful example of that. When we have these dialogues and we see others in the public eye talking about mental health, it goes a huge, long way to normalize the topic for people. I am going to click back and go back to my toolkit.ca. I think I'm just going to go right in this way. My tools.ca. Because I want to just quickly take a look at the stress module. So that was a wellness module that we just took a look at. Let's take a look at the stress module. This one's a little different. So the wellness is all about sort of overall wellness. Stress is a little bit more zoned in on for people who might need some additional information specifically about stress and how to manage it. It includes, like the last module, videos, interactive tools, plain language content, like the wellness module. It includes a downloadable PDF facilitator guide that you can access if you're a youth serving professional to figure out how to use the resource with clients. You know, so again, you can sort of go in a linear way, or we sort of set up the sort of different topics so that they make sense, you know, to set up the topic in a logical way. We, again, hope that this tool can help you to have more in-depth conversations with the young people that you serve about stress. And by providing language and modeling the discussion and the description of stress. So, you know, here we have this sort of hover over to get more in-depth information about the causes of stress. You know, it's different from everybody, and so it's just normalizing and helping young people to identify and have a conversation about what it is that stresses them out. And the tool helps you to open the door to that discussion. If we go to, let's go down here to how to cope. I'm going to play one last video, and so I'm hoping that it'll work. And here, what this video is a video that we created, and it's just young people that we worked with over the past couple of years, just quickly telling us what they do to cope with stress. So I'm going to.
When I feel overstressed, if it's like homework, I'll just take a break, get a drink of water.
When I'm stressed out, I like to listen to music and dance.
Might call up a friend and vent about what I'm stressed about.
When I'm stressed out, I like to dance.
When I'm stressed out, I like to listen to the music.
When I'm stressed out, I like to sit down and relax somewhere outside.
If I'm feeling really stressed, I'll just go for a run, kind of let it all out.
Basically, just hearing from youth describing their own personal experience with stress. The benefit to sort of seeing something like this, again, it opens the door to discussions about how to manage stress in a really relatable way. We just heard from a variety of young people talking about a variety of different ways to cope with stress, and then it's a great jumping off point for discussion with the people that you serve, because you could then turn to them and say, okay, well, what about you? How do you cope with stress? And it's a great way to sort of start a conversation. If we go back to the home page, let's take a look at this topic, the good and bad of stress. When we see these pages, we're going to see some interactive elements, some hover overs to give us some in-depth information about what stress exactly is. This sort of talks about young people identifying when stress could be a good thing, when it works for them. And here, again, we're trying to always do plain language and break information down to digestible chunks. We want to see that, we want to give opportunities to discuss how stress manifests differently for different people. So again, being able to look at this with a young person that you work with and sort of identify that stress isn't just about a feeling internally. It can manifest in physical, behavioral ways, and again, open the door for discussion. With these little hover overs, look at the symptoms it's saying and which ones sound like you. Again, the tool is asking you to have this conversation with the youth that you serve. So I'm going to go back to the home page here and go to how to cope, because this is where we're really trying to get to with probably the youth that we serve. This whole section on, okay, we've identified stress and what it is and how it manifests. Now, what do we do about it? How to cope? So there's that video that we just watched that talks about that kind of stuff. Actually, let's go back to this one. Let's talk about some of the tools that are actually embedded right in this resource. What's nice about this is that Mind Your Mind tools are embedded right in the resource. We know that they're good because we've co-created all of these tools with youth. They've been accessed by many youth from our mindyourmind.ca website. And now we can get into using some of these tools right in this resource as a way to make a plan for how to cope. So there's some self-planning tools embedded in this resource. This is the one we're looking at right now. It's called Coping Kit. And Coping Kit is a little sort of a little book here that they can read through, and you could go through this with the client, or they can do this on their own. And there's actually an opportunity here to sort of type in answers about their crisis plan, things that they can do to help themselves, if they're approaching crisis or in full-blown crisis, what the supports are and what the plan would be. So this might be appropriate for some young people that you work with. But then there's other options. There's another self-planning tool here called Life Journal. I'm hoping that it'll load. For some reason, it doesn't seem to be loading. But Life Journal is another tool that's embedded in this resource. It's really very similar. It's like a little book that they click through that they can type into, and it's more about self-reflection and stress management. So again, you've got some options right in this resource for different tools that might be appropriate for the different clients that you work with based on wherever they're at in their health journey. And again, I'm just going to stress, these were co-created with youth who have been there, done that, and know what would help them in that moment. So we know that they're good, and we know that people are using these, to keep themselves well. Again, as we go through different ways to cope, we sort of talk about, there are different things work for different people. When this resource was created, we were always thinking about how each topic can build off the next. But you can still use different pages on this as standalone resources. This is, this is one about how, if you've got somebody that you work with that's creative and talking about how creative outlets can help cope with stress. And this one's talking about unhealthy things, but then how exercise and physical activity, so that works for some people, whereas it might not work for others. So the idea, again, using this to sort of have conversations with young people about what works for them specifically. So you'll notice now we're on the activity section. I'm just going to go and show you. Activities appears, this last section here appears at the end of both modules. And what this is really great, activities that are intentional, empowering ideas for extension activities that you could use right away. Either some of these are sort of asking a group of youth to do some of these tasks, create a playlist or try some mindfulness exercises, what have you, or they could be done by an individual. Again, really nice because they're just there and they're done for you, and you can just grab those ideas and adapt them if you need to, and run with them right there with your clients. So I'm going to jump to a quick poll question again. Hang on. That's not it. So here's my question for you now is, at this point, we've just quickly gone through and I've shown you bits and pieces here. At this point, can you think of situations where you would use this resources with a young person that you work with?
All right, so once again, just go up and click on the screen and make your choice. This one is a single answer multiple choice, so just make your one selection from yes or no. You can think of situations where you would use this, or where you would use only components of it, or would refer to it possibly, but not open it or use it in an actual session with the youth. All right, so we've got. No one has said no that they can't think of a situation, so we can close that off. We can turn that around, and
that's awesome to hear.
That's good.
And now I'm going to
see this.
You guys one more time.
72% said yes, but 17% would use components of it only, and 11% said they would refer.
That's fantastic.
Yeah.
Great. Thanks for sharing that with us, you guys. And I'm actually going to bug you one more time for a poll question. Thinking about if you said yes, or if you're not, or if you're sure you'd use components, what would you need? What could support you in using this tool?
That's the question actually that we asked earlier. I think we already asked that question.
Oh, okay, never mind.
We may have to.
Sorry, Doug.
No, that's all right.
Well, that's okay. So I'm going to pass this over to Ohenia now to talk a little bit about some other stuff that's part of this resource.
I wanted to just reiterate some of the comments or the points that Andrea has been making with regards to collaborations, and stress that when these tools get created out of a consultative process, that question of what works for you and what would support you in this scenario, I think we ask that so much at Mind Your Mind. That's why we have extras. But we've asked clinicians a lot about this using online resources in particular. And I had a very interesting response from a clinician not so long ago I wanted to share. She was talking about the limited amount of session time face-to-face. And she said, youth already spend all their time on screens and gadgets. So when I'm with a youth, I want to model a conversation that is face-to-face and non-digital. And I raise this because this can oftentimes emerge as a reservation or a barrier to use of resources that maybe youth are more comfortable with than the clinicians themselves. And so, I guess for that, we have to start a conversation around the idea of mobile and how much youth are comfortable with mobile. Because the next resource that I will share with you is a mobile app. And so I want to ask you, even though we understand that youth already spend all their time on screens and gadgets, we also recognize that it's these screens and gadgets that provide the open door to initiate that conversation and strengthen the relationship. And so a counterexample to that is a story from a young woman who shared her experiences with an eating disorder. And the story with this young woman is that she did not feel comfortable enough to talk about her eating disorder face-to-face with her mom even. However, somehow they got into a pattern where she could check in about her food intake, or she could check in general through texting. And she used texting as the medium for conversations about her anorexia. And over time, that facilitated that exchange, and it enabled her to bring it up in other settings and through other media. So from the perspective of youth, never underestimate how much of an opening of a door that can create. And with that, I ask you about your relationship to mobile apps and how likely you would be, how open you are to using health apps in your practice, always as an adjunct to the work that you do with youth.
Looks like 55% say they're very open, 36% say somewhat open, and only a couple of them are saying not open or unsure. So.
Thank you. That's fantastic. That's great to hear. So the next resource I'm going to share with you also comes out of the partnership with the Young Health Program, and it's fingertips-based. It's a mobile app. It's called Mind Your Mood, and it came out of conversation with youth. Its origins comes from their concern. Youth tell us that a major barrier for them to seek support is being able to relate how they really feel to an adult care provider. It is tricky. It is a highly pressurized moment when you do get that face-to-face with the adult care provider to be able to explain and to be able to feel that it's more than just a couple of days of feeling blue, right? So the Mind Your Mood app helps to remove that barrier by giving a young person a record of how they have felt since the last session or the last meeting with an adult support. And this record is displayed in a way that both the caregiver and the young person can understand. It's a mood tracking device that uses plain language, and it allows young people to paint a more complete picture of how they're feeling, and especially and importantly, also to identify what triggers positive or negative emotions for them, and to start making that relationship. So this is broad application for youth in general and for youth under care, and I think that one of its key benefits is that being able to name and reflect on a mood or the moods that you experience as a young person, you can identify maladaptive patterns, you can enhance self-awareness, and then you can use that information to become more empowered and more active in healthcare decisions, right? So obviously I'm not showing you a phone, but this is the interface of Mind Your Mood when you download it, and it gives you the option of 28 moods. There are 7 mood faces. I'll show you some of them today, and it allows you to be as specific as you need to be as a young person. It provides also a scale that allows you to identify the moods that you're feeling and to rate them, and the ability to flag or to add notes to specific events so that you can raise them in conversation when appropriate, when you're finally at that consult with a healthcare provider. You can graph the emotions and the moods that have taken place through the month, and then you are able to print or email that log to a counselor so that you can discuss it. And really, it's this ability to understand the larger picture that makes for a more informed patient or client, and somebody who would have the confidence to really advocate for themselves in the moment of requiring care and securing support. I love the idea of a young person being able to say, look, this is not a passing thing. I've been feeling this for a while, and I need to install some support right away. It's a key statement that is early enough to keep us well ahead of a crisis. That's what happy looks like. That's actually what we look like, too. Yeah. I want to quote Dr. Bruce Ferguson. He's at Hospital for Sick Children, and he is also a co-chair of the Young Health Program. The benefit that he's seen with this app is that it enables a young person to manage their mental health. And he sees that as an important tool because that ability to manage is what builds hope and resilience as young people move forward. It's that sense of having a capacity, right, around the management of your own health. That's a little bit more about the actual functionality, how you can track history, reports, how you might use certain tips to manage and to cope as well. And I just want to stress that support in using these tools is available. So right now we're about to launch the second iteration of Mind Your Mood. It will be available in the Google Play and Apple stores very, very soon. In the interim, we can send you monthly what we call a pro updates to our community of practice. And the benefit of these updates is that they are super quick, super targeted in terms of what you will take away from getting that information. But it would be continuous release of advice on how to use the tools, of questions to you in terms of how useful they are and in what ways you are applying them that are innovative, and also reinforcing the evidence and effectiveness of these tools. So with Mind Your Mood, we have a growing library of stories from clinicians and youth who use the app. And we're often surprised by the new ways that they're finding it useful, or that they almost hack it for their own purposes, right? So it's nice to share that. I'm just going to continue telling you a little bit about the pro updates because this is part of our community of practice. And pro updates comes to your email inbox, giving you very quick, like I said, updates in other areas of the field. So groundbreaking research in child and adolescent health, be it through global partners or broadly, as well as current initiatives in programming at the national level and what's happening in Ontario. And we often also connect to other networks. We're fairly connected to the EENet network, and we share what clinicians and service providers are saying there. And I think that brings an important perspective from many different disciplines, and it allows for the concerns of the community to really come up and become what people notice. And I think that I just want to raise this because we want to make a very clear invitation to you to join our community of practice. We mentioned many times about the importance of collaboration for the work that we do with Mind Your Mind, and we just want to stress how interested we are in collaborating with you. Some of the answers, all of the answers that you have provided to the poll today are essentially what keeps us moving in the right direction. And between what you say and what young people say, we're hoping to make tools that are resonant and that are effective for a longer period of time, that they have meaningful uptake. So my question to you is, how about it? How can we work together in the future? And that question may sound broad, but really, if you're able to collaborate with us in any way, or if you want to provide input or receive our updates, by all means, include your email address in the communications. Thank you. I'm just going to let the poll unfold.
Sure. So it's Andrea again. I'm just going to hop out of our slides here, and let's just take a look. I mean, I'm not sure how many of you are familiar with Mind Your Mind, but let's just show you just quickly, because this is something that you can obviously share with your colleagues and clients that you work with. So this is the homepage. This is the landing page currently at Mind Your Mind. You should know we're not a static website. This page changes daily as we get new content, new tools are uploaded. And I just wanted to sort of take you a tour of where you would go to find certain things so that you can pass it on to young people in your lives, or just use it in your, just explore the site on your own. You should know that one of the most accessed part of our site is our help pages. These are fantastic. We're in the middle of sort of doing a major site redesign. You'll notice the beta there beside. And we've been working very, very hard with young people and with professionals as well to make sure that the site is the best it can be. We've made all sorts of changes, and one of the things that we've done is updated our help pages, which are very comprehensive, very plain language, and been very mindfully created with young people to be relevant to what they've said that they need. So you'll see that there's information here for a variety of different sort of needs or situations that might come up. If it's a young person accessing support for themselves, if they're in crisis, or they're not sure what's wrong, they would click here. They know that they need to speak to somebody. How would they go about doing that? Then we get into sort of more in-depth, what it's like to talk to a doctor, talk to a counselor, the setup of talking to a therapist. One of the things that we really feel strongly about too is building a young person's capacity to help their friends as well as themselves, to give them the language and at least a little bit of knowledge for what they might do if a friend was in trouble or just going through a tough time. So here at our help pages, we've got information specifically about what you would do if your friend was in crisis. Maybe identifying what might be wrong and knowing when to access sort of outside professional help. Really great information of where to call, where to go. They've made an appointment, how to get ready for an appointment. And then even, this is sort of a new part that we put in because youth were telling us about, it can be tough to be the caregiver when you're a young person, to sort of be supporting a friend and understanding the sort of importance of self-care. And then, of course, a list of really comprehensive web links. We've been really wanting, like the A to Z resources, the My Toolkit resources, really wellness focused. And so we have here a whole section on our page about wellness, different and sort of, built into subcategories of different kinds of wellness. If you join our Twitter, we have a very active Twitter feed, and one of their features on our Twitter feed is daily tips, daily wellness tips that change in theme from month to month. And then so all those tweets are sort of compiled and then housed permanently in our wellness section. So, one month, for instance, we had a whole series of tweets every single day about, wellness around transitioning to college. And so those are housed here. Here we've got some nice plain language. If you go to mental illnesses, if a young person just wants a straight up plain language facts about what different types of mental illnesses are, this is where they would go. Again, very created so that it's very straightforward in plain language for those times when you just want some straight up information, whether you're just curious or whether you're wondering if you're manifesting symptoms or what have you, to go and just get some good plain language information. Our interactive section, this is where we're going to see these sort of psychoeducational tools, right? These sort of games and tools that I showed you the coping kit briefly. That's featured in the My Toolkit resource. Some of our apps, and they're sort of also sort of divided into different types. So this is, Get Informed. These are all our tools that would sort of be teaching tools that would sort of give information. These ones are just about stress and busting stress and stress management. This Get Unstuck is about sort of identifying, but then also coming up with strategies and coping tools here. And then here's a list of all of the apps that young people can access from their phones and sort of check out on mobile. You've seen some of the stuff on personal expression. Mind Your Mind is not only a delivery platform for information, it's also a platform for young people to tell their stories in whatever way makes sense to them. And we get submissions all the time from youth from all over the country submitting blogs, just their personal stories and anecdotes about what it was like for them when they were going through whatever it is that they've gone through. Poetry, artwork, we've had young people submit videos, etc. And so this is where you would go to get that sort of informal maybe information. Yes, I've been to the mental illness section and I've read all the signs and symptoms of what, say, bipolar disorder is, but, I want to hear from a young person about what their experience was like with bipolar disorder, for instance. And because we recognize that young people are experts. They're experts in their own experience, and it can be really powerful to hear their story from their own voice. All of this stuff is tagged here. So if you're like somebody that's, you want to come and sort of figure out certain information about a specific topic, if you were to click on the depression tag, for instance, you're going to get any blogs, personal stories, tools, videos, whatever, interactive, that have to do with depression. So you can sort of jump into content in that way. We've done several interviews. A lot of young people find us through our interviews, actually. Like if we've done an interview with their favorite band or their favorite author or singer or sports or athlete, sometimes they come to us through our YouTube channel and find our site that way. And again, that goes back to that conversation we had about Light, the singer. That's one of the videos that's embedded in the My Toolkit resource. Using the pillars of youth culture to sort of start conversations. So this is our site, and I would encourage you also to find us on social media. We have a super active Twitter and Facebook page, and we obviously have to have a presence there because that's where young people are, and we're always trying to meet them where they are. So I think at this point we can take some questions.
All right.
If you have any, and we'd love to do that.
Yeah, we've
Doug,
got.
I just want to say thank you so much for helping us through our video glitches here. It's the first time for everybody to use the video player, so I'm hoping it worked out all right. And thanks for your help.
Yeah, no, that was definitely a bit of an experiment on both of our ends. So I think we have figured out what the issue was, but it was a bit of an unexpected behavior. But I'm sure we can try and fix that for the next time we attempt that.
Yeah. Sure.
So we do have a few questions, and the first one that came in was from Bill, and this was back at the beginning when you were talking about the A to Z modules, and he was asking what the target age group was for these modules. I think you've always sort of referred to youth, but do you have a specific age range that these are targeted at?
That's an awesome question, and yes, that's great. When we were co-creating this, and when I was doing some of the writing, we were developing it. The Young Health Program has always had sort of 14 to 16-year-olds specifically in mind. But keeping in mind too that we try to make it as versatile as possible. But that's sort of the age range. When we're talking about language, we're looking at sort of that sort of mid-high school age group. I hope that's helpful.
Yeah. And one of the other questions that came in early on was when you were talking about the statistics around just mental illness in general, and children or youth accessing resources, and you said 25%. Do reach out. And Allison was just asking, do you have any information about the long-term prognosis of those that do reach out? Do they have a better prognosis long-term?
So I'm not going to have a number to pull out, but I am pulling back to Dr. Bruce Ferguson, and there's a specific video where he talks about that of those who do reach out and those who do secure services, that intervention can be at any point, and it always makes a difference, right? It doesn't mean that you may not manage an illness for the rest of your life, but or quite the opposite. It means that you sometimes may have to manage an illness for the rest of your life, but it doesn't mean that you have to it can be prevented from becoming something else or from making your life smaller and denying you opportunities. So what I think I could do is I could send the video around later. Like I said, I don't have a specific number in terms of the statistics for that 25%. The earlier, the better, and the less it will encumber a life.
And is that video on the Mind Your Mind website?
Yes.
Well, if you just send us a link, we can post that on the Knowledge Exchange Network, and people can go there and maybe take a look at that video because it sounds quite interesting.
That's wonderful.
Thank you, Doug.
Yeah. The next question was, and I saw this on one of your web pages. You talked about evidence-based tools. Allison was asking, are the My Toolkit modules evidence-based, or sort of a? I mean, you don't have to go into the details necessarily, but sort of the evidence or the process for developing these tools. Like, is there an evidence behind all of these?
Sure. So these modules are very much based on a process and a modeled on another resource that we created specifically for our local school board. We were approached by our local school board a number of years ago to create online learning modules for 2 specific courses. And we created one as part of that project for the grade 11 health and phys ed course. That is about sort of an overview of mental health and mental health issues. And that was the resource that was actually evaluated as part of the Opening Minds national study around stigma reduction. And I mentioned at the beginning, sort of earlier, just briefly, that we got the results back from that, and it sort of the results sort of showed us that tool went a long way to reduce stigma and sort of increase young people's understanding of mental health and mental issues. And I guess what we got out of that too, the information that we got out about from that study too, was around the delivery method. That online interactive learning modules are valued by young people, that they liked it. They liked getting the information. It resonated with them because they were getting it in that way. So when we went in then to develop these modules, we really closely looked at what was working or not working with that evaluated resource and used that as a basis for creating these.
All right. That's fantastic.
I'd like to add, Doug, if it's okay, to the notion of evidence-based. This also, as Andrea points out, is part and parcel of our collaborative process. So Mobilizing Minds is one of the research projects, but overall, if you look through all our psychoeducational content, at any point, what we are drawing upon is a combination of the experiences of youth and what our partners are finding out and what evidence they are drawing from. So I'm not sure I'm going to hit on the pages directly, but most of the content that you will see will have at the bottom the sources for that, whether it's coming from CAMH or whether it's coming from other bodies in Canada who are providing evidence for us in the field of mental health.
Next question. Sorry, our next question is from Doug, and not me, from a different Doug. And he says, knowing that the emergency department may see mental health issues that are manifested with physical symptoms, he's asking, is this presently, and I think we can refer to the My Toolkit or the Mind Your Mind website in general, are these resources presently being utilized by nurses to provide information about mental health? So are the folks in the emergency rooms directing people to these resources, or do you have any knowledge of how these tools are being used?
To some degree, we have had conversations with practitioners in the community of practice who are using specific resources. One example, as Andrea is pulling up, and you can also find this in my toolkit, is anatomy of a panic attack. And I'm glad you raised that convergence of the physical symptom and the mental health symptom, because a panic attack is a prime example of that. Often youth don't understand and, again, don't have the language to explain how what they're feeling physically connects. And you have instances of people who are experiencing a panic attack, but it feels either like a heart attack or another physical issue. This resource is very handy for emergency room situations or at crisis points when it comes to anxiety. And it's either mobile or web-based, and it really makes that connection between, for example, the pressure that you might be feeling in your chest, whether that's a symptom of anxiety or it's something else. And it's inviting young people to go to their healthcare providers and look further into what's happening. But at the same time, it is destigmatizing and normalizing the conversation so that if it's not a physical issue, you can begin to talk about the mental health issue and the things that you might do to support yourself through it. I don't know if you want to talk about Be Safe. That's a good point.
Yeah, I just wanted, we just launched recently this app. I'm just going to bring it up. It is an app, though, so I'm just going to take you to the page. You can find it from the site. You can download it from the Google Play or the Apple Store. It's a free app, but in this case, this app is very specific to London and area. It was created by with young people who have been in crisis and presented at emergency room before. A great team of youth that we worked with, and also as part of the London Service Collaborative. This is an app that sort of plays multiple roles. It's an app that a young person would download. They would input a whole bunch of like their personal information that they need about anything, their name, the name of their doctor, etc. Any medications they might be using, as well as like things like coping tools that work for them, making a safety plan. It also informs you about resources in London, Ontario, and surrounding area. And then the cool thing too is that there's sort of like a decision tree part in it that gives young people options for getting help. So how this would work is a young person would download this app, or there's also a paper version for people that don't have a smartphone. They would sit down when they're feeling calm with hopefully an adult, like a support, and fill out all the information. And then if they ever do present, they're in crisis, so feeling stressed, they can pull up the app, they can sort of, again, reassess some coping strategies, go through the decision-making tree to assess, where they're at. Is it time to go to the emergency room, or can I access one of my other coping strategies? And then if they do present an emergency, and the triage nurse is asking them a million questions and needing all this information, then they can pull out their phone and they have all it there, or they can pull the paper copy out of their pocket and it's done. They're not trying to think of what their doctor's name is when they're having a panic attack, and this is being completely integrated. It's being integrated into the crisis intake system here in London, as well as the emergency rooms here. This is an app that's being integrated and used in emergency rooms currently. And again, though, it's unfortunately right now it's only specific to London. But if you want to learn more about it, you can see on the CAMH website more info about it and the development process.
Do you have a section in any of your resources that addresses dealing with a family member or sibling with mental health issues?
Well, when we go to our help pages, there is a lot, it does focus, the language is around helping a friend in crisis, supporting a friend, and also taking care of yourself while helping a friend. And I think a lot of the info there would apply. We have spoken about, there's been times where we've talked about maybe including information around, how to cope if it's a parent or a sibling that's the one experiencing a mental health issue. And so it's not something that we haven't thought of. I think we're just, deciding whether or not that fits in with what we're trying to do and our mandate. But I think a lot of the information, we know that young people come here to sort of access information about how to support a friend, but I think some of it would be applicable to supporting or another loved one.
All right.
I'll add to that, Doug, in that I see that coming out of practice conversations a fair bit. I know that the Mental Health Commission of Canada, one of our partners, last year put out the caregiving support data, and it was frankly astonishing and moving how many young people play that role with their family members. And we know that, at the time of transition and vulnerability that adolescence is, that's a huge role to play. And so it's an important area to develop in terms of service provision, supporting youth caregivers. So I'm glad to see that question came up, and thank you.
All right. Shirley asks, how do young? Earlier on, you had that section where you were showing artwork and other things from youth, and she's asking, how do young people submit their artwork, poetry, or stories to your website?
Sure. There's different places across the website where you can submit. So I'm in the personal expression here, and so a young person could click on submit from wherever they are, and there is some, we're trying to make sure that we're getting the, submissions that are going to be relevant and helpful. So there's a little bit of sort of information here about the submission process. First of all, if somebody's submitting and they're in crisis, this isn't the place to submit. But So it helps them sort of go through a decision tree, and then once they go through this decision tree, then it's about sort of typing in the fields. We don't use last names when young people submit, and they can attach files, whether that be, files visual files of their artwork or whatever it is, or there's just sort of a field for them to type in a personal story, and then. We don't post it. It doesn't go live right away. There's a process. Our content developer gets all those submissions, and we have a huge process. We have a lot of safety process around making sure that we're not posting things that are harmful or triggering, and then it gets up on the site when it's gone through that process.
All right. We have another similar question about, this was, I think, sort of relevant, I think, to this piece, but I think Amy was asking more specifically about, and I can't remember exactly what it was called. It was the online journal. I think it was the crisis something. It was that sort of that little booklet online. The coping kit, that's what it was. I think that's what she's asking about. But she's asking, what's the privacy and security of information of the content input? It sounds like you've got quite a significant process for these submissions. Is that similar for that coping kit?
That is an awesome question, and I'm glad that came up because I should have probably said something earlier. Yes, when a young person, whether it's through the My Toolkit resource or from the website, when they decide to use one of our coping tools, none of this stuff is saved. So when they're typing in their answers here, I hope you can see the crisis plan. So when they're typing stuff in here, we're not saving any of it. And in fact, if they exit the tool partway through or at the end without printing, then it's gone forever. Nobody's saving this information. This is for a young person either just to do on their own, just to get it out onto a screen, and writing can be very cathartic for some young people, but then really for these, they have an option at the end. I'll try to click forward at the end to print. So down here it says print your crisis plan. Another thing that's interesting is that you could not fill out any of this. You can go back to the beginning and you can just print off a paper version if that's easier, and then just fill out the stuff by hand. So there is, privacy is huge for us, and we certainly don't keep information. This is all, none of this is saved or housed anywhere.
Yeah. All right. And we have one last question. We are right at 12:30, so it is time to wrap up. But we've got one last question here, and Leona is asking, do you have any adaptations? She's asking for youth that cannot read, but I'm also wondering if there's any adaptations for youth that have any kind of disabilities and in managing any of these tools.
It's a good question for growth. I know that to date, up until now, we have been very mindful of different learning styles. And so part of the reason why you might find resources in video rather than just print form or just diversity of media is that hasn't been to date a concerted or secured process that addresses the needs of the hearing impaired or vision impaired so far. I think we could just say some of the resources are applicable, but we're not designed with that end.
Mm-hmm. But that's you're right, and when you say there is a variety of tools that are written versus audio, video, that sort of thing. So that certainly does provide lots of options for those who are not able to read or visually impaired, etc. So that's great.
Yes, that's correct. Thank you.
Yeah, so that's all we have for questions. So I think we're going to wrap up now, and we'll hand it over to you one last time for any final closing comments or anything that you might want to wrap up with.
Not so much a comment as a thank you. We just want to make our information accessible to you as well, and invite you to visit the site as much as you can. That's me signing off. Thank you very much.
Thanks again to everybody, and Doug, thanks for moderating for us. And it was great to hear your responses to the poll questions, and lots of food for us to move forward. Thank you so much.
All right, and again, our apologies to the audience for the hiccups with the video, but we will have the full quality videos in the recording and links to them on the Mind Your Mind site as well. So you can certainly go back and look at them afterwards. So as I again, we did record this. So if you did miss anything, or if you enjoyed it so much you want to watch it again, or share it with any of your friends or colleagues, please go ahead. All of the information will go out in an email in a couple days, and it will be posted on the Knowledge Exchange Network on the page that's on the screen in front of you. So thank you, Eugenia and Andrea, and it was fantastic. You guys at Mind Your Mind do great work. It's always very cutting edge and creative and really awesome. And I'm one of your followers on Twitter, and I do encourage everyone else as well, because you guys do have lots of great stuff coming out on Twitter. So thanks again to both of you for such a great presentation, and of course always to the audience for joining us. We do these presentations usually every Wednesday at 11 a.m. Eastern time. Again, it is the summer, so we're only having a couple over the summer. I don't think our next one is until I think we're back on in September, actually, I think is when our next one is. So we will hope everyone has a great rest of their summer, and we'll see everyone back at the CAFC Presents webinar series on Wednesdays in September. So thanks again for coming, everyone, and we'll see you then. Bye, everyone.